Kenzie B. 1 in 4 deaths can be attributed to alcohol, tobacco, and illicit or prescription drug use. This is according to Richard Rono, a professor at Moy University, in the Journal of Education and Practice published in November of 2019. Everyone in this room is susceptible to addiction, although we may not be aware of it. For example, many of us are addicted to our phones and don't even know it. The Minnesota Department of Education should require a class on the effects of drug use. First, I will discuss how drug use is a problem in teens. Then, I will talk about how requiring a class on the effects of drug use could be the solution. I will start with talking about the problem of drug use in teens. Drug use is a very prevalent problem in society today. According to Dorna Elena, a professor at West University of Timisoara, in a presentation at the SPECT conference in 2018, over 100 million people around the world suffer from substance abuse. Teenagers are some of the most vulnerable people when it comes to substance abuse for a couple of reasons. To start, they are more susceptible to the social pressure to experiment. They try drugs in an attempt to fit in or be accepted. This is according to Leonard Min, a research scholar at the Lawrenceville School in the International Journal of Arts, Humanities, and Social Sciences Studies, published in July of 2023. Secondly, drugs can cause more damage to a teenager's body due to the fact that the mind and body are still developing. For example, the prefrontal cortex is a part of the brain that is responsible for decision-making and impulse control. This part of the brain is not fully developed until age 25. This means because that the brain is not fully developed, addiction for a teenager could progress faster than it would for an adult. Lastly, teens use drugs in an attempt to cope with mental illness. In the 2021 National Survey on Drug Use and Health, 27.7% of teens who used illicit drugs had a past year major depressive episode, versus 10.7% who did not. The lack of information on the negative aspects of drug use is also a reason for a higher number of substance addicted people. A study was done at West University of Timisoara on students ages 14 to 18. The study was aimed at identifying the level of awareness students have on the effects of illicit drug use on their bodies and psyche. The respondents of the study confirmed that the role of non-formal education in informing them on information and skills is needed to prevent early onset of drug use. According to Safet Hassan Sujan, a professor at Jahangir University in the Journal of Public Health, published in January of 2021, the negative impact of drugs can affect an abuser's academic life as well as physical well-being. Drug use can cause accidental injuries, it can impair judgment, and it always has the potential for addiction. Now that I have explained the problem of drug use in teens, I will discuss my solution. The Minnesota Department of Education should require a class on the effects of drug use. A school is one institution that has a very important role in the development of young people. Studies have shown that even students agree that there needs to be more education on the effects of drug use. If done properly, schools could be a source for primary prevention. School-based education on substance abuse should involve educating the teen on how the effects of how drugs and alcohol affect you, as well as how to stop, avoid, or get help. First, I explained the problem of drug use in teens. Then I discussed how having a required course on the effects of drug use could be the solution. The Minnesota Department of Education should require a class on the effects of drug use. If we start to require a class on the effects of drug use, then teens can fully understand the consequences of drug use, and hopefully we can prevent some of the 1 in 4 deaths that can be attributed to alcohol, tobacco, and illicit or prescription drug use.
3:56.